My name's Tony Young. I'm the founder and executive director of Community Education Group. Community Education Group is celebrating its 30th year. And all these people have probably, well, it's maybe not you, have heard this before, but I always kind of lead the why are we here with this. I say that there is a train that's been roaring through the Appalachia region. The engine of that train is the Oxycontin crisis many of us know or knew. It's now a poly-drug use crisis. The next car in that train is hepatitis C, hepatitis B, hepatitis A. Educational attainment challenges, workforce development challenges, economic development challenges, with the caboose of that train being HIV. And I ask people to visualize that train being laden down with coal. The environmental impact of coal, the economic impact of coal, and then the psychological impact of coal. Lost jobs, economics, more about coal, right? And so what Community Education Group tries to do is to be and do a couple of things. Bring resources, opportunity, and attention to the Appalachia region. To make people know what it is, who we are, not what they think we are, and not who they think we are, and what we do, and what we need. We want to tell them what we need. The other thing we want to do is that we want to be the boulder in the track that stops that train. We want to disrupt all of those things. That's one of the reasons that we're doing this summit at the Greenbrier, because we believe that this conversation around a syndemic, HIV, viral hepatitis, substance use disorder, and economic development and workforce challenges is an important conversation and a critical conversation, and we wanted to hold it in a space like the Greenbrier. And what I wanted to do this year, I made a commitment to visiting all 12 of the states and hosting town hall meetings where we could begin to have conversation with understanding what people think versus what I think. Because, you know, I'll sit around and think of a big idea in 5 minutes. And easy, Turbo.
Did you not see my face?
But I'll come up with an idea in 5 minutes and say, this is what we need to do. But then realize that, you know what, maybe that's not aligned with what we really need to do. And we want to talk to the people and see kind of what we're thinking. Want to talk to you about that. Want to hear what you're thinking and what you need. But most importantly, want to let you know and introduce you to some people who are doing some great work, not just in Virginia, but all throughout the Appalachia region. I'm going to start with the mayor, who I just met. Do these people know you?
I don't know.
Why don't you introduce yourself?
My name is Amanda Pillion. I am the mayor of Abingdon. I've been the mayor for about 14 months, and I've been on town council for 3 years. I am a native of Southwest Virginia. I grew up in Tazewell County. I have lived in other places in the world, but have landed back in Southwest Virginia a couple of times. My husband serves in the state senate, and he has been, he's the head of the Opioid Abatement Authority, and he has been very, very active in working on the opioid crisis in our region. So I'm just really glad that you all chose to meet in Abingdon. I'm glad we have all these visitors here. I hope you've gotten to enjoy our town a little bit in this really nice early spring weather. And if you want restaurant recommendations or other things, I can point you in the right direction. But thank you all for being here and for all of this important work.
Well, thank you. We're going to talk about opioid remediation and settlement. That's going to be a big part of what we're going to chat about tonight.
I'm Danny Clausen. I'm the executive director of the Virginia Harm Reduction Coalition. We serve Roanoke City as well as the West Piedmont Health District. So that's Franklin County, Henry County, Martinsville City, and Patrick County. Our organization's been around for about 5 years. We just passed our 5th year anniversary from when we incorporated, although we've been around since 2017 unofficially. I've been in this role for about 2 years, and it's just been the most edifying experience to be working on such an important issue in this region. I'm really grateful to be in community with really brilliant people that have been working on hard in this region for decades, and so great to be here.
Which job are you going to talk about?
Oh gosh, I can talk about both. It may be relevant. And so I am Tamara Holmes. I actually work for the Commonwealth of Virginia, and so I actually wear 2 hats. And so for the purpose of tonight, it may roll into both, but my primary role is actually the director of the Office of Broadband. And so my job is to ensure that every Virginia home and business and community anchor institution has access to broadband. My other part-time job, which seems to be full-time. I have the pleasure of serving as the Virginia Appalachian Regional Commission Program Manager. And what that means is we're in Richmond. We also have an office here in Abingdon. And so our job is to talk to communities and organizations who are interested in seeking funding for great ideas. We just talked about one. And so the Appalachian Regional Commission focuses on economic development, but not in your traditional sense where the only thing they focus on is creating jobs. It's about creating a healthy workforce. I can go through the laundry list of all the resources, and we'll probably talk about that through this evening's conversation.
I want broadband in my house next.
Okay. Give me your address and I'll tell you where it's at.
This is not, we had this conversation for years now. So I am Beth O'Connor. I'm the Executive Director of the Virginia Rural Health Association. We're a statewide nonprofit advocacy organization serving the 2.5 million people who call rural Virginia their home. We have a number of projects in relationship to training, education, community development. We work with a lot of smaller community organizations that don't have the capacity to maybe do projects themselves, things like grant writing, grant management, and then also advocacy. It's been part of my time talking to our elected officials about how the decisions they make affect health and healthcare in rural Virginia.
Perfect. So I'm gonna do a couple of things. One, since we're a small group, I'm gonna ask you to tell me who you are, where you're from, and what the most important issue, given that train, or in broadband, opioid abatement. Tell me the topic that you work on or think about or care about in your household or in your work, however you want to do it. Name, where you're from, and big topic, big idea. Oh, and you can give a big idea if you got one, because these are the idea people.
My name is Andy Hall, and I'm actually from Greenville, Tennessee, and I am the Director of Community Health with Velocity Bio Group and also HICMA. And so basically what we do is advocate for all forms of naloxone to be made available in our communities. And then we also educate about Plaxato, which is the 8 milligram for certain patient populations. So.
Perfect.
And then I can say ditto to all of that, except
Your name,
I have a name. No, we're thrilled to be here. Thank you for letting us come. I'm Amy Pittman, and I'm actually the community health manager for the state of Virginia. So I'm thrilled to get to meet you guys and to learn about all that's going on here. So
Perfect.
same thing with her.
Thank you.
Plaxato.
Elvis Fields, apparently okay. Sorry, I didn't mean to interrupt. But no, Elvis Fields, I'm a veteran peer specialist with the Virginia Department of Veteran Services. So I work with veterans who suffer with PTSD, suicidal ideation. Also work with veterans who suffer with substance use disorder as well. Mainly more on the behavioral health side, but we are expanding that onto the substance use disorder side. So I'm glad to be here and look forward to making some contacts here.
Perfect. Can I ask you one question
Sure.
before we go to the next person? VA has done one of the best jobs actually in the nation in responding to hepatitis. Do you guys do any hepatitis outreach work or any work in that regard?
As of right now, no, not at this moment, we
Okay.
don't. Again, this is why we're trying to, we have focused a lot more on the mental health side of things, just because, especially with a lot of the conflicts that have just ended, we see more mental health concerns, and we focus more on that. And then as we get those mental health concerns taken care of, we get veterans connected to those resources regarding substance use disorder.
Okay, cool beans. Okay. Yeah.
I'm Robin Seaman. I am over the mountain in North Carolina, kind of Banner Elk Boone area. I have the business Appalachian Healthcare Training and Consulting. I'm a certified transcultural nurse, which probably everybody could say, what in the world is that? But I tell people that basically means I view healthcare, everything through the lens of culture. And I have really just devoted my time and attention over the last probably 7 years, really focusing on improving health outcomes in rural Appalachia, and just have a lot of grandiose ideas as far as really needing to really approach the culture of all the different people that live in Appalachia and tailor our messaging in that way to be accepted. Because we all know, there's a lot of distrust issues. And so really trying to bridge that. Through the pandemic really kind of got me more in a direction of really focusing on vaccine confidence. And so I've done and am doing a lot of work with that.
Perfect. How about you?
Sorry.
Oh, no, you. Your luck's not that good.
My name's Paige Lucas. I work in the local health department. I'm the epidemiologist.
I am Linda Austin. I'm the Executive Director of the Appalachian Substance Abuse Coalition for Prevention, Treatment, and Recovery that covers the 13 counties and 3 cities of far southwestern Virginia. And I'm happy to tell you that we helped get the first treatment facility open within 150 miles of Abingdon with Todd Pillion's help. We got the first opioid abatement authority grant in Commonwealth Virginia. So we've had 20 graduates. Fairview Housing owns and manages that property and does Medicaid treatment there. And they also have a men's facility in Bristol, so now we have men and women's here in far southwest. So my ministry is being gifted a building. We have a real problem with children being removed from homes because of SUD here. And so we have been gifted a building. We are working with DSS and CPS to try to intercede those removals and give the parents the option. I don't know, some of you may not be familiar, but Mountain Mission School is in Buchanan County, which is an hour and 47 minutes from here. And they will take children in need from anywhere in the world. They just took 7 in last Friday from the Ukraine. Their parents sent them here to keep them safe. And so they have, now they have 159 kids living on campus, going to school. It's fully accredited school. They have 47 staff members that live there with the kids and take care of them and house them and feed them. So we want to stop the removals and allow the parents or the grandparents or the great-grandparents or the aunts or the sisters, whomever has custody of the kids who are struggling, to entrust the kids to Mount Mission while they themselves get treatment now that it's available here. So we are going to turn that building into a women's residential facility. And so, yes, so when they finish treatment 60 to 90 days at men and women, they can come to us for another 2 to 4 months and we can help them get housing and reliable transportation. I'm sure you all know the problem transportation is around here. We want them to have 6 solid months of supportive housing before the kids come back. They never lose custody of the kids. Mount Mission doesn't take it. It doesn't cost the families or the government anything. It's privately funded. So that gym, they have more than 100 beds empty. And kids all over the place are being removed from their homes for no reason. And often separated from their siblings, which I'm the 7th of 7. I cannot imagine being separated when I was little from my siblings. So we're gonna get that open soon.
Amazing.
If you pray, please pray for us, guys. It's a little scary.
Well, I mean, I think that, you know, those are kind of like innovative projects I think that we want to talk about and hear about. You just walked in, so I'm sorry. You are?
I'm Brianne Kelmer and I'm with the Mount Rogers Health District. I work in population health.
Thank you so much. Lavina, who are you?
Hi everyone. My name's Lavina. I've been the one who's been probably bombarding you guys with emails about this event. I am from New York but based in DC, and I'm really happy to be here, learn a little bit more about rural Virginia and specifically Abingdon.
Well, welcome. You may decide to stay. We are accepting new residents.
I know a house that's vacant in downtown
All right.
Hello.
Hello.
Again.
Again.
My name is Beth Slate. I live in Saltville, Virginia, where the opioid struggle has been very real for decades. And I'm basically just here invited by these guys, which I met today, just to learn more, see what's out there, see what's happening, just to see what I can do in my community to help.
Hi, my name is Deidre Speaks Johnson. I am an HIV advocate. I don't know how you would tell that. I'm here in one specific capacity, I'm actually the co-founder of Ending Criminalization of HIV and Over-Incarceration in Virginia, or ECHO VA. Myself and my partner in change, Dr. Cedric Pulliam, are responsible for changing the HIV criminalization laws here in Virginia in 2021. So we're here for that, but I'm also the National Programs and Strategic Planning Manager for Zero Project, which is the premier organization that focuses solely on HIV crime. So to answer your question, all of those parts of those caboose, I'm the caboose, but all of the parts that are trains before that, cars before that, we feel that impact from everything. So we're really here to be a resource, a source, but also to work together with you all to make sure folks know about HIV crime, but also how we can start to prevent some of the things that are happening, and then also get into the opioids and make sure, because if you don't have access to things, then you then may be for reasons to prevent HIV from happening to you. So glad to be here, and thank you.
Perfect. Lee?
Hey everybody, I'm Lee Storo, on staff at Community Education Group. Really appreciate everybody coming out. I'm a native of Western North Carolina, grew up in Asheville, so about 2 hours over the state lines, but live in DC now.
Oh, I forgot to say, I'm originally from Amelia County, Virginia, and you already know that's rural enough, but I actually live in Colonial Heights, Virginia.
We could have drove together.
Yes, we could have. I'm considering going back tonight, so.
Brandon?
I'm Brandon Morales. I'm the media manager here at CHE, and I'm a Virginia native, specifically Manassas. So closer to Northern Virginia, but still, not necessarily Nova.
Perfect, thanks. Okay, oh, there you go. Well, here's the first question I've got. How come we don't have broadband everywhere?
Because I'm talking to Lieutenant Governor. She asked that same question.
And I'm asking the question because broadband is so central to all of our healthcare needs, our economic need, our workforce development need, our transportation need. It's just central. And since I got the person who's got the answer, I'm thinking like that.
Sure. And so I will say, Virginia, we like to say Virginia has been doing broadband expansion before it was cool. And so back in 2017, the General Assembly at the time allocated $1 million. And the $1 million was to, and I'm gonna read the budget language verbatim because I've memorized it over the last now 7 years, is to supplement the cost for the private sector to construct broadband. And so you hear the word private sector. And so it's, as the former broadband advisor used to say, the math is not mathing. And so basically what happens is the low density in rural communities, the economics aren't there for providers to build out based on their own dime. And so Virginia, in its infinite wisdom, now 7 years ago, put $1 million in an idea to expand broadband. And so that million has gone from 1 million to an additional 1 million to a 4 million to a 19 million to 50 million to 750 million over the span of the life of the program. And so we're currently, with those investments, building out in 86 counties across the Commonwealth to give over almost 400,000 homes, businesses, and community anchors access to broadband. And so Virginia was one of the first states to do that, and this is with state money. This is without any federal money. We did not receive federal money until the American Rescue Plan Act was passed by Congress. And so we received that money in 21 through the previous administration. And so Governor Youngkin is committed to ensuring that every Virginian has access to broadband, affordable, reliable, high-speed broadband. And so through that, we're gonna get broadband. If I don't do anything else before I retire, I'm gonna get broadband to Beth's door. And so we are, we've been, I feel like it's both a passion, and it allows everyone, as you said earlier, all these things that happens as a result of getting access to broadband, being able to bring folks into what is now, are we still in the 21st century?
Yeah.
The 21st century. And so a lot of folks don't have access, and I would like to say, even before the pandemic, with investments from the Tobacco Commission and early investments from the General Assembly, when COVID happened, 140,000 Virginians had access to broadband that did not have it before the pandemic. And so again, we've been investing in broadband before it was cool, and I always want to give credit to Southwest Virginia. And I say that I know other folks here from other states, it's because if you pull any statistics, Southwest Virginia, particularly far Southwest Virginia, if you're talking about Buchanan, Tazewell, Dickinson County, they are actually one of the most connected parts of the country. And actually, they have more connections than actually Roanoke, sorry.
I believe it.
And so they're considered, what they say it in the news, it's highly digitized region. And part of that is because early investments by organizations like the Virginia Coalfield Coalition, where they put in fiber, the early investments of Bristol, Virginia Utilities, which is now turned into an investment of a private sector provider called Point Broadband. And so I would say Southwest Virginia is well connected. There's work to be done. They also have some of the best performing broadband projects that we're currently invested in. And I would say from Smith, Washington, and Wood all the way down through the coal fields, we have some of the best broadband projects that are happening right now, and the innovation around education. And so one of the things that's important is literacy around how do you utilize the internet in order to do telehealth and telemedicine visits. And so one of the things I will share with you is Smith County Library received a grant from us where they train their librarians without our money first, to train their librarians to be digital navigators. And so those folks actually were training residents on how to access the internet, how to set up email accounts. And so we invested some of what will be the Infrastructure and Investment Jobs Act funding, if you all heard about. It's called, sometimes it's IJA, sometimes it's BIJA, because they add the bipartisan in front of it. But Virginia will be receiving $1.5 billion with a B of the $42.5 billion that the federal government is investing solely in broadband. And so the first thing we're supposed to do is get the job done. And so with Virginia, we'll be getting the job done, but we'll also be focusing on many of the things that will come up during this conversation this evening around, if you have access to the internet, how do you make sure you use it properly, but also use it in a safe manner? And so being able to access telehealth and telemedicine is important. I know we talked about telemental health services and things of that nature, and even some opportunities around substance abuse recovery. I tell the folks from CEG all the time, I actually started out getting a doctorate in public health, and then I took epidemiology and I changed my mind. And so I ended up getting a doctorate in public policy. And so this is like my first two loves get combined together around doing broadband, also being able to do the Appalachian Regional Commission program, but then also being able to create a healthy workforce. And so broadband is one of the tools in the toolkit that will allow us to do that.
So here, and I'm not gonna pick on you all night, I swear I promise. I swear I promise, but I'm gonna start out there. Is that, so if I am Joe or Jane Schmo,
right?
I don't have the internet at my house. How do I know who to call to get the internet or get free internet to my house? How do I know that I'm supposed to call you and bug you like every single day and leave voicemail messages and emails in your email box?
And so we actually take those phone calls and we answer those email messages. And so I wasn't joking when I said to Beth, give me your address. Because I can literally, on this iPad, type in an address and tell you whether you're currently in a project that we're funding or in the new federal funding that will be coming to the Commonwealth from the federal government. But honestly, at the end of the day, a lot of it is education and awareness. I will tell you, when we started this back in 2017, I can't tell you how many local leaders said to us, we've been calling company X, who we know currently provides broadband in our community, but we don't get a response. And so I told someone a couple of years ago that a lot of my early work was like Match.com. It was like local county leader, local town leader, local city leader, connect with company X to say, okay, well, maybe they don't realize everyone does not have broadband, or the definition of broadband has evolved over time. And so DSL, as of today, is not considered broadband. Well, most of our communities, those residents have DSL because it's not reliable. And so that's what they had. And so we are working with providers to upgrade those DSL systems to maybe a fiber, maybe a hybrid coaxial. And so I would say continue to email and call us, because we can drill down specifically to who does not have broadband in Virginia and who actually does. We also have a program, and this is a shameless plug, called a Line Extension Customer Assistance Program. And so if you live in a community in Virginia, and let's say I know this happens here because we have a lot of projects down here, and it's technically in Southside Virginia, where houses are like a mile off the road. And so those families may have called their local cable company, and they've gotten a quote for X thousands of dollars. We actually have a program that will cover that cost 100%. For families that make less than $170,000. And so that's another way to get broadband to your front door quicker, because if you live a mile off the road or more than 300 feet off the road, we will cover that cost for families that are within that income.
Perfect.
And so I say continue to call, continue to email. That's our job, is to
Right.
make sure that we don't miss anyone, because the thing that we all know, and that's why epidemiology was my bane of my existence, and both the love until I studied it. That's how you get there. Is the data. The data around broadband access has not been good, and the federal government is doing a better job. Our General Assembly, even before the federal government was doing better mapping, we were doing good mapping with Virginia Tech, or phenomenal mapping with Virginia Tech, and so we have great data on access in the Commonwealth.
So now, I want to talk a bit about opioid remediation or opioid settlement, depending on how you want to call it. And what I'm going to ask you is, Beth,
Yeah.
you know, the opioid settlement money. Here's my so I might be slightly prejudiced, right? Go figure. And in this way, is that a part of what we've done is try to collect as much information and data as we can. If you don't know, we have a newsletter that goes out every month on opioid remediation in all of the 13 states.
Get the newsletter.
It's my favorite email I ever get. It's like when it shows up, I'm thrilled.
Good job, Lavina.
And so, one of the pieces of that, though, is we did it because what we think is that we've got to figure out strategies to make sure that these resources get back to communities that this crisis is actually built on the back of, right? But does it get to the hollers? Does it get to the homes? Does it get to, Joe and Sally who may have lost a kid? Does it get to Joe and Sally who may still need to go to treatment? Does it get, so talk to me, all of you, about your role, what you've seen, barriers, challenges, facilitators to access to this money. What do we need to be doing that we're not, and what are we doing that's working well?
Sure. And I think an important place to start with the abatement funds, if people aren't familiar, is the way the lawsuit was structured. The funds can only go to the cities and counties. So you'll hear a lot of, this organization should apply for the funds. That organization should apply for the funds. Yeah, maybe they should, but they don't qualify. They need to go through their county government, or they need a coalition of counties, or work with their city government. So the big thing to understand is you need to talk to and educate your city and county officials, because a whole pile of money is going to entities that don't necessarily know what to do with it.
And when you say entities, those of you that have not participated in the calls that I do every month, I interrupt everyone. They all know. But so when you say don't know what to do with it, meaning they don't know how to plan it, they don't know how to distribute it, they don't know who to give it. When you say that, what do you mean?
And some counties and cities know more than others, but you have situations where you have county managers, city managers, elected officials who don't know why the money is showing up, don't know what they're allowed to spend it on, don't know what community partners would be good partners to spend it on, don't know what best practices are. And there's, fortunately, the Abatement Authority built lots of guidelines and bumpers to make sure that it heads the direction it should. But you're definitely going to see some areas moving ahead faster because they made good partnerships and are better clued into what should be doing. You're also going to see some places where they don't know, and they don't necessarily want to know, and they don't know what they're doing, they don't care. And so I would encourage everyone to talk to your local city and county managers, to talk to your local elected officials at the city and county level and say, hey, what are you doing with your abatement funds? And go from there.
Man.
Well, we don't actually, the town of Abingdon doesn't actually get any any abatement money.
Right.
But the county of Washington does.
Uh-huh.
And I will admit freely that I am not educated on how they are spending their money. I am assuming that they have supported you guys at Mended Women which is, if you've not visited that facility, it's just the most amazing thing you've ever seen. And I don't know what else the County of Washington is doing with their money. I'm sure that my husband could tell you a lot more about that than I can. But I do know, as far as education goes, when I've been to VML events, they had a big educational event last year to explain to local officials how it worked and how to spend their money. And so I know that some of our county officials went to that.
I didn't mean to put you on the spot.
No, that's fine.
But we're here, we're family now.
That's fine. I'm one of these people that if I don't know the answer, I will freely admit it and tell you where to find it.
Okay, and I really appreciate that.
Yeah, we do have this thing called the Dillon Rule in Virginia, and
Right.
sometimes we have to explain to folks how that works.
So Tom, your turn.
Yeah, I mean, I completely co-sign what Beth said in terms of people not knowing and understanding, because it can, at first glance, our opioid abatement funding looks very complicated. It's not. Like when you sit down and dig into it, you're like, that makes total sense. But people get lost in the jargon, right? Because a certain proportion of funds go directly to the city and counties, and then there's this other proportion of funds that goes to joint applications. So if 2 counties or 2 cities wanted to get together, and you're only eligible for that if you've already been designated as somebody that's doing a best practice and blah, blah, blah. So you get to this point where there's some glaze over happening. So I think that's a major barrier, is people just not even understanding how the fund works. I also think something that municipalities have been struggling with is it's not a lot of money right now. So they're starting to get their first payments, and it's like $17,000. And that sounds like a lot of money.
For some it's a lot more. Hold it.
Yes,
Yeah,
but like for example, Roanoke City, their
Right.
first installment was only $17,000 for a
Right.
city of 100,000 people. What are you going to do with that, right? How you can't get a program up off the ground. So what you need to leverage this money immediately is community partners that are already there doing the work. We are very lucky in Roanoke that there's been a lot of organizing for years and really good foundations and communications that have been happening. So there are community partners there that can say, I know what you can do with that money, give it to me and I will. That's what we did. I have been able to secure some funding for our program through OAA funds as like a sub-grantee, right? But if you don't have that, especially in these more rural counties, for example, Martinsville, where we do serve Martinsville, and we have an employee there that is just brilliant and is a native to there, and her, even with all the expertise that she has and that we have in our agency, they're still totally lost. Their city council's still totally lost. And so there needs to be support or infrastructure for these small communities, because it's over the course of the project, any given municipality could get anywhere from hundreds of thousands of dollars to over $1 million, right? But that's going to be over 10 or 15 years. So how do you can't just stand up a whole new program right away. How do you leverage these kind of small funds to build upon service organizations that already exist, and collaborate with people, find other sources of funding to match those funds? And again, if you're not used to that, if you're running a public body that doesn't rely on grant funding a lot, it's such a whole new world for them to be able to navigate. And so yeah, I would say to the OAA, if you want to tell your husband, one of the things that they can do is that they really need to create a support network, education, training for these smaller counties and cities that really don't have a first clue of where they're going.
Is there existing technical assistance around opioid?
In terms of the funds?
Yeah.
Yeah, definitely there's resources on the VOA website.
Yeah.
And if I can do a total shameless plug.
Yeah, I'm used to it.
So as you know, because you've been a guest, we have our own podcast. So if you go to VRHA.org and click the podcast tab, if you scroll down, there is an episode just on the Virginia Opioid Abatement Authority where I interviewed their executive director. And so within that, you can listen to the feed, but then there's also links to the Opioid Abatement Authority and other resources. Yes, I will.
Why you write it up there?
I got it.
We also have the the Roanoke Valley Collective Response has kind of situated itself as a technical assistance entity that's helping counties and cities in their catchment area. Now, I don't think anybody is here from that catchment area, but the director, Robert Knack, it's underneath the Roanoke Regional Commission. He's still happy to share some emails, bend your ear, even though our purview is Roanoke Valley. I know that any one of us, you can call me, like I am happy to talk to people about how to use these funds and ideas and, help out with community needs assessment. I have a master's of public health. I've been doing community organizing since I was 18. So there are resources out there, and even if we're not technically in your district, we want people to get this money and we want to use them to use it well.